It's my pleasure to present the results of our recent international survey exploring perspectives on brain imaging surveillance in metastatic breast cancer. At present, routine brain imaging is not recommended for patients without neurological symptoms, as no survival or quality of life benefit has been demonstrated. However, with the advent of CNS active systemic therapies, effective local treatments such as stereotactic radiotherapy and neurosurgery, the balance of risks and benefits of surveillance may have shifted. To address this question, we conducted an international online survey between May 2023 and February 2024, targeting both physicians and patients to better understand their attitudes toward brain imaging surveillance. Over 500 physicians, mainly oncologists and academic centers, participated. About 2/3 reported requesting brain imaging, especially in HER2-positive and triple-negative disease. Among physicians performing brain imaging in asymptomatic patients, 312 reported on timing. Approximately 80% requested it at first diagnosis of metastatic breast cancer and approximately 90% at extracranial progression. For physicians not currently performing brain imaging surveillance, the main reasons that would adopt it are evidence of improved survival, impact on treatment strategy, or recommendation in international guidelines. On the patient side, we gathered responses from more than 500 individuals across Europe, the majority living with metastatic disease. Most express a willingness to undergo surveillance, particularly younger patients and those with a hormone receptor negative disease. Importantly, nearly all patients wanted information about brain metastasis, while only 13% of physicians routinely discussed this topic. These findings reveal a striking gap between patients' expectations and current clinical practice. Patients value proactive monitoring and open discussion, whereas physicians remain cautious in the absence of clear evidence. While several randomized clinical trials on surveillance in metastatic breast cancer are ongoing, recruitment remains a challenge and results are awaited. In the meantime, two key messages emerge. First, counseling about brain metastasis should be incorporated into clinical discussions, with decisions on surveillance tailored individually. Patients need to be informed of potential benefits, such as early detection and CNS active therapies like trastuzumab deruxtecan or ducatinib combinations, but also of possible drawbacks, including anxiety, false positives, and overtreatment. For example, toxicities of the targeted treatment options, as well as morbidity of neurosurgical procedures and the possibility of radionecrosis following stereotactic radiotherapy. Second, we need more refined tools to identify patients at high risk, going beyond the established risk associated with molecular subtypes. Artificial intelligence, leveraging clinical, imaging, and molecular data, has potential to refine risk assessment and support personalized decision-making. We sincerely thank all participating physicians, patients, and advocates for their valuable contribution. Your input is essential to advancing our understanding of brain imaging surveillance in metastatic breast cancer.